Let's talk Coachella Valley.
I'm Conrad Negron with Tina Marks, your host for a fun show.
Informative show.
We're going to entertain, explore the Coachella Valley.
Give people a lot of knowledge, a lot of things that you have not heard about. We're going to bring it to you here.
And welcome back. We are at Perch. We're our home away from home where we film. And today we have the pleasure of welcoming back Dr. Malcolm Lesavoy. Welcome.
Thank you. Thanks for having me.
We had you on a prior segment. And for those people that didn't see that segment, I want to go over briefly some of your credentials. I had to actually print this out. This is 2 pages of resume, and this is the summary. Your complete resume includes 101 pages. I've never seen anything like it in my life. You are so accomplished. In 1977, you became a part of the American Board of Plastic Surgery, and you are also the clinical professor at UCLA School of Medicine. You've been on Nip and Tuck. You've been on Extreme Makeover. I can't believe that somebody actually has that much time in this lifetime to accomplish what you have accomplished. You've also authored 3 books, 30 articles. I mean, the list does go on and on. Are you still at the UCLA?
Yes.
You are, okay. Full-time?
No, I was full-time professor there for 25 years.
Okay.
And then I decided this part of my life, might as well try to make a living. So I opened a private practice in Encino.
Yes. And what's the name of that practice?
No, that's just Lesavoy Plastic Surgery.
Okay.
And essentially, I do my big reconstructive cases at UCLA, and I do my aesthetic cases in Encino or in Beverly Hills.
Or in Beverly Hills, okay.
But I'm still a professor there at UCLA, and I still teach the residents and give lectures, and not only at UCLA, but around the country and the world, too, for that matter.
And now we have the pleasure of having you in our valley on Fridays, and you're going to be working with Dr. Feld out of the same office.
Exactly.
So the Valley residents are going to be able to experience you, which is absolutely amazing. And when you are choosing a plastic surgeon, what are you looking for?
That's a very good question. First, you really need to make sure that they are board certified and they're a real plastic surgeon. Unfortunately, in Los Angeles, for example, if you look in the yellow pages under plastic surgery, 60 or 65% of those people listed are not plastic surgeons.
How can they call themselves a plastic surgeon?
That's a good question also.
What is their training?
This is a free country.
Yes.
And in a free country, you can call yourself anything you want. And as a matter of fact, if you look on the internet, a lot of people call themselves plastic surgeons who are not plastic surgeons. And so you really need to do your homework, and buyer really beware. Those doctors who list themselves as plastic surgeons in the yellow pages or on the internet could be dermatologists, gynecologists, ophthalmologists, ear, nose, and throat doctors, and some ear, nose, and throat doctors do very good facial surgery. But the others, I think you have to really be wary of. And so the best thing for a patient to interview a person is to call the American Society of Plastic Surgery.
Okay.
And they can find out if the doctor that they are going to see or have seen is a truly board-certified plastic surgeon. Now, it doesn't mean that every single board-certified plastic surgeon is fantastic because we have the bottom of the barrels and the top of the barrels, just like any profession specifically. But at least you have the sine qua non of the person being honest.
Okay.
And that is key.
Absolutely, because it is your body. You can't change. You can't reverse certain things. I mean, they have now this reality show, Botched,
yes,
to reverse a lot of these things. And I understand you. Did you train?
Yes, Dr. Dubrow was one of my residents, and he asked me to go on Botched the first season, and I said, oh, maybe not. And then the second season. But he wants to have me on the third season, so I'll probably go on there.
Oh, fantastic. But we're still going to have you here in the Valley.
Oh, yes. I'm going to be here on Fridays.
Oh, good. Oh, fantastic. Okay, so I want to talk about fillers, okay?
Yes.
Now, I use Botox,
yes,
and I do use Restylane in my lips, and that's about the extent of it. Now, as somebody ages, first of all, what do you feel about fillers? Are they safe?
Yes.
Is there? It is. So the body's not absorbing any kind of toxins or poisons or anything like that.
The short answer is that they are safe.
They're safe.
Years ago, we were injecting collagen, and there are a number of patients, there were a number of patients who were allergic to collagen. Mm-hmm. So we always did a test, a little skin test, to find out if you were allergic to the collagen. Mm-hmm. But these days, in the synthetic fillers like Restylane, Juvederm, these types of Perlane, these types of fillers, I have not heard of any allergies. Of course, it always could be, but it's possible. The key is to have an experience.
Oh, so that would be it, if you are allergic to it.
That's correct.
But not, how about if you're injected in the wrong place? Can you hit, I mean, you can hit a muscle and it could
yes, it is
possibly
possible.
die? Or,
it is, well, I don't know about dying, but it can cause some damage. And so you need to go to a qualified person. Now, some dermatologists and some otolaryngologists, some ENT doctors and plastic surgeons all are very familiar with Botox and with fillers and do it very, very well. And so you don't have to be a board-certified plastic surgeon to inject fillers. Many dermatologists, their entire practice is injecting fillers and Botox.
okay.
Yeah, so it is a good thing to eradicate some of the concavities in the skin.
Okay, so I'm going to use myself as an example right now. Outside of that, I am noticing a little bit of a drop here, jowls.
Yes.
Okay, and my other concern is under my eyes can get very crepey.
Yes.
So what would you suggest for those
Okay.
two?
In your particular case, I would not inject anything. I mean, I'm just telling you the truth.
Aw, you hear that?
The key is that if a patient comes in and just wants to have something done because they feel there's a little imperfection of that sort, and you do it, then sometimes it causes more of a problem. In your particular case, you're talking about the jowls. The
Yes.
jowls is a fullness. If sometimes
Doesn't feel like it feels like a dropness.
well,
and if, I almost feel like it creates
Okay.
a frown line.
that's a different story.
Okay.
Yeah. Now, what we do is we call these marionette lines.
Okay.
You're too young to have seen Howdy Doody on television.
I've heard of it.
Okay. But it's this puppet that his mouth would go up and down. We call these Howdy Doody lines.
Mm-hmm.
And so these, in some patients, we can truly inject and fill out that concavity, so to speak, that dent in these vertical lines.
Oh.
And so that's where
And that would be filled
fillers-
with what? Botox
no,
or
no,
Restylane?
no, with a filler.
With a filler, okay.
Let me just explain a little bit the difference between Botox and fillers.
Okay.
Botox is a medication, if you will, that actually relaxes muscles.
Okay.
It relaxes muscles. Fillers is a different type of situation, which is like a collagen type.
Plumps it.
Which actually fills in stuff.
Got it.
Exactly.
Okay.
It doesn't relax muscles. It doesn't paralyze muscles. Botox is a relaxer of muscles. And so if we have these creases, kind of these 11s, so to speak, between the eyebrows, we use Botox in that area so that the cross-looking appearance when you
So you don't
cross
look so
your
angry.
eyebrows, exactly, relaxes.
Yeah.
But we don't want to put too much in, because
No.
if we put too much in, then
You don't have any expression.
Exactly.
Exactly.
When you speak to someone,
Yeah.
you have to have some expression.
I agree. And most
Yeah.
people don't want any lines at all. I don't really get that. So what would you recommend for me? I know you said you wouldn't do anything,
Yeah.
but if it was bothering me, the crepiness under my eyes, is there only
Yeah.
one thing you could do? Or, I mean, outside
now-
of eye creams and things like that?
Yeah, you bring in another situation now. One thing we have to understand is the anatomy of our eyelids. The lower eyelid has very, very thin tissue paper thin skin, and our cheek skin, where the lower eyelid joins the cheek skin, is very thick. And so we call this the trough.
Okay.
And so sometimes patients have a sunken trough, and we put a little bit of filler into that trough.
Oh, you can do
to
that.
equalize the areas between the lower
Ow.
eyelid skin and the cheek skin.
Okay.
But in your particular case, you said, well, what about the crepiness? Well, if you put fillers under this very, very tissue paper thin skin,
That's not gonna-
it's not good.
So
it's
it
not
would be,
good.
it would be
It-
facelift.
No, not facelift, but a lower eyelid.
Or lower
Exactly,
eyelid. Okay.
Exactly.
All right.
Yeah.
Well, we're going to talk more about that. We're going to talk about facelifts, and we're going to talk tummy tucks, and we're going to talk breast augmentation on our upcoming episodes. You're not going to want to miss this. He's definitely going to be back. Thank you. Thank you so much for
Thank
being
you.
here.
My pleasure.